Okay, in this video, I'm going to talk specifically about issues related to medical paternalism, just to introduce some basic concepts, discuss what paternalism is and what it is not. And then in another video, we'll talk about actual practical applications of these kinds of things and potential objections to arguments in favor of medical paternalism. Okay, now, paternalistic action simply involves violating or infringing on an individual's autonomy to promote what is believed to be in their best interest. So, this is different from other kinds of considerations known as nonmaleficence, which I'll get to momentarily. Here, we're concerned with doing what is in an individual's best interest, regardless of whether or not the individual actually recognizes it or believes it. So, you violate a person's autonomy when you act towards them in ways that they would prefer that you not act in towards them that way, or they desire that you not act towards them in that kind of way. So, in medical cases, this involves either directly treating a patient against their will for some reason, going through a certain kind of medical procedure uh, where a patient either doesn't desire that the procedure be done or believes it's not in their best interest for it to be done. Now, but even cases that involve some sort of manipulation or coercion or deception from a medical professional to a patient, this would also count as a paternalistic sort of action. So if you deceive another individual or coerce them or manipulate them to agree to a certain kind of procedure, that does involve paternalism to the extent that there's some sort of use of force here, not necessarily physical force, but so for example, Immanuel Kant thinks that when you lie to another individual, you deprive them of their freedom and hence violate their autonomy. So by lying to another individual, you deprive them of information or you withhold information that is relevant to their making a decision. So in this case, if a physician lies to a patient and as a result of their lie, the patient agrees to a procedure or to a course of treatment that if they had been adequately informed or had they not been lied to, they wouldn't have agreed to, that counts as a violation of the individual's autonomy. Right? Okay, now, but there's different types of paternalism. So the clearest cases involve what's known as strong paternalism. So strong paternalistic action occurs when we engage in that kind of behavior towards individuals that what we could call sufficiently competent or autonomous. Now, what it means to be sufficiently competent or autonomous will depend upon the actual circumstances. So, in medical contexts, an individual needs to be legally competent and sound, to make their own medical decisions. So, if an individual is already not within that sort of legal category of medical competence, where medical professionals, psychologists, psychiatrists deem that this individual is not medically competent, okay, that would not count as an instance of strong paternalism. Now, but what we need to keep in mind is that competence in an area of medicine is not the same thing as competence in other areas. So you could be medically incompetent and yet still be competent to make other kinds of free decisions for yourself. So in this regard, part of competence involves the ability to anticipate and appreciate the potential consequences of a given course of action. So if you don't fully understand or are incapable of understanding the potential ramifications of either refusing treatment or going through with treatment, that would knock against your competency. Now, weak paternalism occurs when we violate the autonomy of individuals or infringe upon the autonomy of individuals that are not sufficiently competent or autonomous. And the classic case of this is with children. So children are autonomous to certain degrees. So my children are competent with respect to deciding what they're going to wear that day. We grant them a degree of freedom in picking their outfits, sometimes with a little bit of guidance. They're competent to decide what they would like to eat for breakfast, for example. But none of my children, and I have three, none of my three children are competent to make their own medical decisions. They're not competent to decide whether or not they would like to be vaccinated. They're not competent to decide whether or not they would like to go to the dentist. And sometimes um, their mother and I need to engage in some sort of coercion or force to get them to do these kinds of things. Okay. Now, there are some out there that argue that, well, when it comes to the leveraging the expertise of the medical professional against the patient, what we actually have in cases of medical paternalism, these are all cases of weak paternalism. In the same way that parents are much more informed than their children about potential benefits and risks and potential harms that might come through a given course of action and the like, so are medical professionals in comparison to the patient. So if paternalism is justified weakly with respect to children, well, if patients are the equivalent of children, in a medical setting, then there really aren't any cases of strong paternalism. Every case of so-called strong medical paternalism is really just a case of weak paternalism. Now, but that argument can't really get off of the ground because we do understand, at least contemporarily, that oftentimes individuals are perfectly warranted and justified in either refusing medical treatment for themselves or withdrawing from medical treatment. So, autonomy contemporarily plays a strong role in medical decision making. And given that paternalistic action infringes upon autonomy, that is why medical paternalism needs to be morally justified. And the burden is on the individual actually engaging in the paternalistic action to show or demonstrate that such a paternalistic intervention is justified. Why? Because autonomy is just that morally important. Okay, now, but there is room for variance here. So, um, pure paternalism is when we are primarily concerned with the welfare of the individuals that we are violating. So, if my children protest about getting vaccinated, but I understand that it's in their best interest to be vaccinated, I take them to the doctor against their will and I vaccinate them. We try to calm them down and maybe buy them a milkshake or something like that, but they're going to be vaccinated. They don't understand, uh, the nature of diseases and potential infections. They don't have the full capacity to understand how helpful vaccines are. So yes, my wife and I, my partner and I, we do vaccinate our children against their will. Okay, so that would be pure paternalism, where the class of individuals whose freedoms you are restricting or whose autonomy you are violating are the people that you hope to benefit from such a intervention. Now, impure paternalism is when we are not primarily concerned with the welfare of the individuals who we are violating. So the individuals whose freedoms we are restricting is not necessarily of primary concern here. Uh, it's the welfare of other individuals primarily that we are concerned for. Now, it's here that once again, a lot of ethicists and philosophers will wonder whether or not there actually are any legitimate cases of impure paternalism. Why? It seems that cases of impure paternalism can be captured under a given principle of non-maleficence. Now, here's why. The principle of non-maleficence says that we are permitted to restrict individual liberties to protect other individuals from harm. So, if your present rather poses a threat to another individual, um, we are usually justified in removing you from the situation in order to protect what we would call third parties from harm in this case. So if you pull a weapon out on somebody, we can tackle you and handcuff you, and that's a violation of your autonomy. But in this case, it is a justified violation of your autonomy. Okay, now, so with respect to certain kinds of public policies and medical interventions, um, these kinds of things, particularly public policies, can be justified on multiple grounds. Okay, so for example, I live in Illinois, and every college campus in the state of Illinois is smoke free. Smoking is not allowed. Now, obviously, a lot of smokers complained about this. Um, some smokers might say, well, it's not the government's job to tell me what's good and bad for me, so on and so forth. If I want to smoke, I should be allowed to. And the government, the state's perspective is, well, yeah, we're not telling you you can't smoke. We're just telling you you can't smoke in these public spaces. So, I mean, if you want to smoke in the privacy of your own home and harm yourself through smoking, God bless you. But there's a certain thing called secondhand smoke, and it causes cancer. So here, a smoking ban, it might look as if it's paternalistic, where we're really trying to get, we're restricting the activities of smokers primarily because we want smokers to quit smoking. Okay, that could be, but such a policy can also be justified on the grounds of non-maleficence. We could say, okay, we're not primarily concerned with making sure or pressuring smokers to quit smoking, even though smokers probably understand that smoking is bad for them. No, we're trying to protect non-smokers. We're trying to protect third parties that are affected by secondhand smoke. Okay, so you can't object necessarily to such a policy, a smoking ban, on paternalistic grounds. So if you're opposed to paternalism in these kinds of cases, and you say, well, it's paternalistic for the government to tell me where I can and cannot smoke. No, not necessarily. We can take this from the angle of non-maleficence. Now, the same thing can be said about things like vaccine mandates and mask mandates. So a lot of people that were opposed to either mask mandates or vaccine mandates or both were opposed to such things on the grounds that these kinds of things were paternalistic. Okay, here we have the government trying to protect us from ourselves. That may be true to a degree, but it's also true that things like mask mandates and vaccine mandates protect non-involved parties, individuals that are vulnerable, individuals that are immunocompromised. So given the fact that these kinds of public policies can be justified from multiple positions, a paternalistic objection, if you're opposed to paternalism in these kinds of cases, that itself is not a knockdown defeater for these kinds of public policies. So if cases of impure paternalism can largely be explained in terms of non-maleficence or something else, then that's why some philosophers think there may not even be any cases of impure paternalism. Now, clearly, with a smoking ban, non-involved third parties, non-smokers, and smokers stand to benefit from such a policy. Why? Because smoking is harmful. When it comes to vaccine mandates and mask mandates, both parties, those who are opposed on paternalistic grounds, and immunocompromised third party, they both stand to benefit. But as far as what justifies the policy, we can justify such policies on the grounds of non-maleficence without bringing up any sort of concern about paternalism. Now, other situations which may look paternalistic but probably are not paternalistic, um, usually involve reminding individuals about things that they're already informed about or already know. So, for example, if I see you getting into your car to drive somewhere and I notice that you're not buckling your seatbelt, um, I might remind you to buckle your seatbelt. I might remind you about these statistics that show that seatbelts save lives. Now, you already know that, right? By me telling you that seatbelts save lives or me reminding you to buckle your seatbelt, I'm not telling you anything that you don't already know. But due to a momentary lapse of judgment or something like that, you might either just forget to buckle your seatbelt, or you might be saying, well, I'm just going around the corner to the grocery store, so why do I really need to buckle my seatbelt? But if I say, well, and I remind you to buckle your seatbelt, and you say, oh yeah, and you go ahead and buckle your seatbelt, um, this would not be paternalistic precisely because it really doesn't involve any kind of coercion or force or manipulation. So you understand that seatbelts save lives, and my reminding you to buckle your seatbelt um, is not a violation of your autonomy. Now, what would be a violation of your autonomy in this regard is if I remind you that seatbelts save lives or something like that, and you say, well, I'm fully aware of the fact that seatbelts save lives. I know all the statistics about seatbelt use and so on and so forth. However, I find the minor inconvenience of wearing the seatbelt is just too much for me. So I would rather run the risk of dying in a car accident than going through the minor discomfort or inconvenience of wearing a seatbelt. Now, in this kind of case, I would be acting paternalistically towards you if I engage in some sort of threat or force or manipulation to get you to buckle your seatbelt. But if I just simply remind you to buckle your seatbelt or inform you about seatbelt saving lives and those kinds of things, um, that would not be paternalistic. That it might look as if it's paternalistic, but it's not actually paternalistic. Okay, now, one of the chief individuals philosophically that was against cases of paternalism was our good friend, the utilitarian John Stuart Mill. So, in his treatise on liberty, John Stuart Mill talks about how important liberty and individual autonomy is. And Mill says a couple of things about this. He says, first of all, the individual usually knows what is best for them. So individuals typically have a better idea of what constitutes their own welfare more than other individuals do. Now, and in particular here, John Stuart Mill has the state in mind, the government in mind. So this individual citizen typically has a better idea of what is best for them or what is in their best interest or self-interest, more so than the government does. Okay, now, so if that is the case, then the default authority on best interest would be the individual rather than the state. But if the default authority on what is in one's best interest is the individual themselves, that is why we are very, very, very precarious. We need to be very precarious and careful about granting the state or granting the government or any authority for that matter uh, the authority or the freedom to interfere with our autonomy and with our liberty out of concern for what is best for us. Okay, now, but John Stuart Mill makes an exception here. So John Stuart Mill thinks that a exception to this is that individuals cannot use their freedom to freely surrender their freedom. So clearly, John Stuart Mill supports non-maleficence. He says if we need to interfere with individual liberty to protect third parties from harm, absolutely. But again, the burden of proof is on the individual interfering. But Mill also says the one exception to a paternalistic intervention would be if we need to paternalistically intervene to prevent an individual from freely becoming a slave or freely surrendering their autonomy to enter into indentured servitude or something like that. Now, the reason why Mill thinks that this is the case is because to freely surrender your freedom is to violate the very principle of liberty and principle of autonomy that is used to justify an anti-paternalistic stance in the first place. So if freedom is that important, if your individual autonomy and your liberty is that important, then we're not going to allow you to surrender something that is that important. So Mill says, well, I guess if we paternalistically intervene to protect individuals from becoming slaves or surrendering their freedom or something like that, or violating their own autonomy, then paternalistic action is justified, but only then is it justified. However, it's with this perspective on Mill that we get problems. Okay, so there are a couple of different readings of Mill here. Okay, so on the one hand, if this is an absolute prohibition, so the idea, the anti-paternalistic idea, if that's an absolute prohibition, if there's an absolute prohibition on paternalistic intervention, then this is inconsistent with utilitarianism. And John Stuart Mill is a utilitarian. So, on utilitarian grounds, whether or not any given course of action is justified, or at least on act utilitarian grounds, if any given course of action is morally justified, it's morally justified just on the basis of the consequences, whether the consequences promote happiness or cause harm, or some combination of the two. So if Mill means this anti-paternalistic position as an absolute prohibition against paternalism, then this is inconsistent with his utilitarian moral philosophy. Now, if Mill just means this as a general prohibition, so in general, paternalistic intervention is not justified, then a general prohibition can obviously admit of exceptions. And given the fact that John Stuart Mill himself makes an exception to his own anti-paternalistic position, it seems that either whether it's an absolute prohibition or a general prohibition, it's hard to get such a strong anti-paternalistic position out of John Stuart Mill's writings. Okay, now let's move on. So, under what kinds of circumstances might paternalistic intervention be justified or warranted? Okay, so I've already talked briefly about seatbelt laws. So we understand that seatbelts save lives, but we also understand that wearing a seatbelt is in many cases a minor discomfort or a minor inconvenience. Okay, now some of the reasons why various kinds of paternalistic interventions do seem to be justified or warranted could be for a couple of reasons. So, first of all, we often give irrational weight to certain kinds of values. So, with the example of seat belts, if you prefer to not endure the minor inconvenience or discomfort of wearing a seatbelt, but you're weighing that against your own physical safety, your own life, that is an irrational weight. So the fact that you would rather risk being seriously harmed, injured, or even die in a automobile accident than go through the minor inconvenience of wearing a seatbelt, that is what we would call an irrational weight. Okay, so there's a couple of different ways that we can give our values irrational weight. So on the one hand, we can be mistaken in our desires and values. We can desire or value things that really are not worth desiring or valuing. Now, but what seems to be sort of uppity and seems to be sort of know-it-all-y and just dripping with paternalism is to come along and tell people that they're actually valuing or desiring the wrong kinds of things. So we need to be careful here. Again, this is precarious because it does sound really sort of cringe to tell somebody, well, the kinds of things you desire and the kinds of things that you value are not really worth desiring or valuing. Well, who are you to tell me what I should desire or value? Right? That sounds kind of cringe. But at the same time, we recognize this all the time. We can be mistaken in our desires, we can be mistaken in our values. And sometimes we need either be nudged or reminded or coerced into realigning our values or realigning our desires. So if you really would prefer to not wear a seatbelt, even if it were to come at the risk of your own physical safety and the like, a paternalistic intervention here through, ticketing you through wearing your seatbelt or something like that, that seems to be warranted and justified. Okay, now another way that we can give our values and our desires irrational weight is that we can actually fail to act consistently with our own values. Okay, so there's a reason why I picked a let me go back here. There's a reason why I chose a picture of a stack of donuts here. All right. Um, so if you've ever been on a diet or you've ever quit smoking or something like that, or you set goals for yourself, sometimes you need to be reminded of those goals that you set for yourself. So if I tell my wife that I would like to lose 20 pounds, and then she sees me sitting on the couch just hammer fisting donuts into my face, double fisting donuts into my face. I get a dozen donuts and I plan on eating all of them. My wife might just come alongside of me and said, okay, remember that goal you had in mind of losing 20 pounds? How exactly is this helping you meet that goal? So here, my wife will just remind me of what my goals are. Remember the other day when you were saying you wanted to get back in shape or something like that? How is this actually going to help you? So I'm acting irrationally because I have a rational goal in mind. I want to improve my physical fitness. I want to get in, improve my health. I want to get in better shape. I want to have a more positive body image, whatever the case may be. These are all good things. But if I'm sitting down on my couch eating a stack of donuts, this is not going to be the kind of thing which is going to help me meet that goal. Now, with a patient who desires for their condition to be reversed or improved upon, if going through with a certain course of treatment or going through with a certain kind of medical procedure is necessary to meet those ends, to the extent that the patient really desires or really values getting better or improving their condition, this seems to be a situation where a certain kind of paternalistic intervention might be justified. Now, here is why. We often delegate our autonomy to others out of concern for having a certain kind of weakness of the will. Okay, so if I know that um, if I know that I want to lose 20 pounds, or if I know that I want to get in better shape or something like that, I might pull my wife aside and say, okay, I give you permission to intervene if you see me doing things that are not in accordance with this stated goal. If you see me acting inconsistently with this kind of goal that I have set for myself, I authorize you, in this case, as my partner in life, to intervene on my behalf. So if you see me buy a dozen donuts, I give you permission to take the donuts and throw them away. I give you permission to take all the sugary, sweet kinds of things and throw them in the trash can. I give you permission to, bug me to go to the gym or bug me to drink a glass of water, whatever the case may be. So if you see me acting out of a given kind of weakness of the will, I want you to help me reach this goal, and I know that I will thank you for it later. Okay. Now, so in these kinds of situations where we suffer from some sort of weakness of the will, what Ronald Dworkin in particular thinks is important is if at some future time where we stand to benefit from this kind of paternalistic intervention, if at a future time we would think that paternalistic intervention was justified, then it would be justified. So if months from now, after consistently not eating sugary sweets or you know putting up with my wife, bugging me to go to the gym or whatever the case may be. If when I'm in a better position months from now, if I look back on the times where my wife at the time seemed to annoyingly bug me or remind me about my stated goals and things like that. So, I'm sitting down with the donuts and she says, "John," and I say, "Yeah, I don't care. I'm going to eat all these donuts." And she just takes the donuts and throws them away. If she were to do that at the time, I would be very, very angry. I would say, "What are you doing? Those are my donuts." But if after the fact I look back on that and I say, you know what, my wife was right to take the donuts and throw them away. My wife was right to keep reminding me or bugging me or coercively and manipulatively getting me to act consistently with my stated goals. If at some future time I would look back on that and say, she absolutely did the right thing, then her paternalistic intervention was justified. Now, another important thing to keep in mind is there are often cases, particularly in medical situations, that involve a certain kind of psychological distress and anxiety. So, an individual experiencing a certain kind of psychological distress or anxiety may not be in the best position to make decisions for themselves, especially decisions that have potentially permanent or lasting consequences. So, a prime example of this is cases of medical euthanasia. So, in the United States of America, even in states where medical euthanasia, in this case, physician assisted suicide, is legal, there's a waiting period. There are certain protocols that need to be followed with making sure that individuals are not clinically depressed or are not suffering from some sort of mental impairment. Why? The decision to end your life if you are terminally ill or experiencing irreversible suffering, that's a permanent decision. So it's because the stakes are high that we typically try to intervene in cases of psychological distress or anxiety. Why? Because we don't want people to make important decisions about things that they may regret later. So, medically, we might recommend a waiting period until an individual is in a better state of mind to make this kind of decision. Now, but more importantly here, it's in cases of psychological distress or anxiety where a patient may be suffering nervousness or anxiety or fear about a potential diagnosis or prognosis, that medical professionals in particular need to be very, very, very careful about how they go about presenting information. Um, so if I know that a patient is already nervous or anxious about either a diagnosis or prognosis, I may not want to give them all the gory details, even if they ask for all of the gory details. Um, it's possible to just completely overwhelm individuals with information in such a way that by just overwhelming them or overloading them with information, you completely remove their decision making capacity. So in those kinds of situations, when medical professionals leverage their expertise in a way to coerce or manipulate patients into making decisions, the patient might just be so overwhelmed that they just delegate all authority to the physician. Now, that's paternalistic, and that kind of paternalism may not be justified if we can get a patient to agree to a course of action without manipulation or coercion. That is going to be uh, optimal. That is going to be the best case sort of scenario. But if if at a future time a patient would understand why a certain kind of paternalistic intervention was made and they're the better for it, then in those kinds of cases, Ronald Dworkin in particular thinks that cases of medical paternalism are justified. Okay. All right. That will suffice for now. This video is getting a little long. So in part two, we'll talk about potential objections to paternalism.